Hello, it's John Kanellopoulos from a center here in Athens, Greece, the Laser Vision Ambulatory Surgery Center. And we're going through, they're not keratoconus rounds, they're not refractive surgery rounds, they're anterior segment rounds. We're seeing here a lady who's visiting us from Tampa, Florida. And she remembers she had 2.5 years ago a laser procedure for glaucoma. No other details was given to her besides the fact that she remembers the word open glaucoma. Sure enough, considering that she's hyperopic, and we're going to see her IL master 700 here, and we can see the hyperopia. Her action length is 22.7 in both eyes. She has a cataract forming. She's in her early 60s, 62 years old. So we can see here the cataract lens thickness is almost 5 millimeters. Anterior chamber depth is close to 2 millimeters, left eye, right eye. And it is obvious that she had a very nice laser iridotomy in both eyes. Interestingly enough, both eyes at 1 o'clock. Interestingly enough, she saw a colleague in Tampa as well who said your laser was not justified. They did it without cause. Let's talk a little bit about this, because I thought this only happens in Greece. Once an iridotomy is done, if the angle is very close, the angle deepens. So it is very difficult for us in this, indeed, narrower angle, this is about 10 degrees, to be certain that this iridotomy was placed as a necessity or not. Likely it was, because it is a narrow angle, and we see a very nice patent iridotomy, laser iridotomy. But we also see cataract formation here, which may have not been present 2.5 years ago. So if we had to deal with this patient today, I would have recommended for her to go directly to cataract surgery, correct her hyperopia, and resolve the issue of a potential narrow angle. In regards to whether it was done or not for a cause, I think it probably was, and it shows not somebody who's fully knowledgeable of how the anterior chamber works to say, well, the angle is not very close now that you have an iridotomy, you shouldn't have it done. So always deal with the patient, and this has been my, this is how I was taught, and this is what I've done throughout my career, as if they were your patient, as if the decision you had made, that was made by a colleague, was done by yourself. And I think this rule resonates, and you hope that this happens with other colleagues as well. Hope you found this interesting. Of course, we discussed with this lady that her future beholds cataract surgery and her becoming almost spectacle independent. We'll shoot for half a diopter myopia in her dominant eye, 125 in her non-dominant eye, turn her into a half diopter with the rule astigmat. And in our hands, this gives better than 20/20 vision at distance and anywhere between J1 and J3 for near, but with incomparable quality of vision, excellent contrastivity, results far superior, in my opinion, than a trifocal or an EDOF lens. Again, cataract, closed angle glaucoma, anterior segment rounds. John Kanellopoulos for Athens. Thanks so much for your attention.